Thank you, Genevieve, for arranging this beautiful conference. And
Thank you,
also, when I
Pankil.
checked your email, uh, it was good that you are doing this for a cause. Mm, and I was just there that I am with you and the team, whenever you required for anything such like this. So after we had a beautiful session from Dr. Meeta, whom I know since long time, and she's doing wonderful thing in her place. The levels in homeopathy. So my presentation would be a little bit more towards a different level, wherein we would deal with a lot of factual level patients, and as we all know that during COVID time, that was quite a stressful for all of us. We as a homeopath, as a patient's family, and it was a kind of a stramonium feeling, initially for everyone, puzzled and what to do, how it is happening, is it true, is it fake? But then that was a different kind of journey, among the different kind of waves and different lockdowns. So but that was a time, where it was a time tested thing, and people turned towards homeopathy. Initial they were all a chaos. I think that same holds true for for everyone in India, maybe Bulgaria, Europe, every part. Initially there was a lot of this chaos. What is it, how is it happening, is it true, how to treat, where people and scientists were just figuring out different medicines and trying different things. At that time, the first patient which started in month of March, also 2019 or 2020, and the symptoms, how we take is the detailing of the symptoms. You see how we see in homeopathy, how is it different than other different pathy, is in terms of understanding of patients. Now we not only see the reports, but along with that, what we also see is what is the type of symptoms coming. We have to go to the detail of every symptoms. Like, for example, there is a case of fever. The fever, is it in fever, is it happening in the morning, is it happening in the evening, what is happening just before fever, during fever, and after fever? So that's why whenever you come across a homeopath, you will see he would try and ask lot of questions which you would wonder, why is he asking me? But those are the detailed symptoms which will help us to analyze and make a picture pattern of you and match it with our pharmacopoeia, like how there is a pharmacology book in allopathy. We also have our own literature, and which will then help us to give you a medicines based on that. Like, for example, today I had a patient, with severe chills and fever. He used to be, like shivering, constant shivering and shuddering, and with high rise of fever. It used to go to 102, 103, and with terrible headache. The headache was as such, she took two paracetamol, still the pain was unbearable. I mean, such type of patients, we have to see the association of symptoms. Like there was chills before fever, there was weakness, there was a lot of discharges which were coming out, and then there was this terrible headache. So when we matched this set of symptoms, a remedy which was coming was China Rs. And then we gave Chininum Rs, China Rs 1M in 3 powders. And then we saw, the pattern, the fever doesn't just subside after one powder. What happens is you need to see the pattern. So earlier when the fever was coming after taking antipyretics in say 3 hours, this time after taking one dose, the fever came again after 8 hours. So you see the pattern, the body was trying to heal itself. And then after third dose, there was not a single symptom of headache, chills, or fever, anything left. So that is the beauty of homeopathy. It will help you to recover on its own by stimulating your own immunity. Now, well, when you go to gym, you won't build up muscle just in a 1 week's time. It requires a regular, consistent pattern. So that's the same thing what happens in severe chronic cases. More down, the more suppressed your body is, the more time it will take. So it's not about a myth what people feel about whether homeopathy is slow or fast. It's super fast when it comes to the acutes. And I'll show you with few cases in my presentations, how we dealt, my team, I have a team of doctors working with me, how we dealt with this pandemic. And the best part is, in COVID, maybe few more waves might come. But if you are through with this, then, homeopathy is a ray of hope. First of all, there's a minimum cost compared to the amount of people, getting admitted and the amount of insurance and cover and bills. Second, it's without any side effect. It is safe. It can be used by any age group, and it boosts your immunity. And obviously, there are less deaths. None of my patients who under homeopathic treatment died, except for the some who might have come in the last phase. But I have a database of about 1,500 cases, before and after treated. I'll show three of them, in this presentation. And this is not the first time. Homeopathy has been time-tested medicine with the latest scientific development. And you see
Sorry,
in this
sorry,
picture,
Pankil, these 1,500 cases are yours, or you have,
yes,
wow,
my cases. Yeah.
great work.
So it's my team case, I would say, when we were working on this past 2.5 years. And when we saw this, in typhoid, cholera, yellow fever, cholera, Spanish flu, in all this uh, pandemic also, right
That's
from
amazing,
1800
Pankil.
century.
You're great.
Thank you. Just trying to work, with pure homeopathy and do whatever is best possible. And we saw that, the mortality was much less with homeopathy. And we see, like now every doctor have hands-on treating COVID, and they are also confident enough. But the thing is, how early we pick up and diagnose the case is important. The more early we pick up, that's the time where the disease has not progressed much to multi-organ level. And that's how we can treat based on different set of remedies. Sometimes you need to give one remedy, or sometimes you need to repeat, and sometimes in some critical cases you also need to give two remedies. That what I found with some failures also, while giving just one remedy and just seeing through. But when we started some different pattern, we saw the success rate was much better. And for that, what we did was we started having awareness campaign. We went to different societies, different schools, and then how we used to do awareness. And simple things, which every people should have at home is pulse oximeter, the temperature recording chart, and what to do when you are just with initial symptoms which you are not sure about, COVID or cough cold coryza. So we had a different videos which we recorded, we published, we sent across, which is there on the YouTube. And majority of the symptoms we everyone know, everyone us know that it started with headache, fever, fatigue, lot of secretion of mucus, dry cough, sore throat, breathless. Now in this fourth wave, the different what we saw was there was a lot of gastric symptoms, a lot of nausea, vomiting along with fever and headache. Although the pattern was different in different waves, first and second were the deadliest one. The third was mild, and the fourth one is even the mildest. But those who didn't have COVID any time, for them this also was the first time, when they experienced this tremendous weakness in this set of symptoms. So everyone should have at the clinic or at home are this thing, gloves, mask, sanitizer, pulse oximeter, thermometer. And strictly when you are in fever, I avoid them, to take a lot of antipyretics. Just trust your body pattern and make a chart like this. Maybe you can take the picture of this page and give it to your patients, just with a patient name, date, time, oxygen, temperature, pulse, and medicines. In medicines, you can write if they are taking paracetamol, just mention when they took, so that we can again come to know when the temperature was rising and we can have a pattern. Or if they have taken homeopathic medicine, I tell them to write, first dose, second dose, third dose. So this will also help us to evaluate, what is the pattern, what is happening. So this, if you see in this particular chart, you see, timeline and what was the oxygen and or what was the temperature pattern which was coming. There was this other patient, you can see the fever goes to as high as 104, 104.5 at 7 p.m. So with this temperature also, you need not panic, nothing happens. The only thing is you need to be confident about giving the right remedy. and so on. See, these are the charts of my patients, who maintain in not just COVID, but also any kind of fever, whether it be simple viral flu or it can be any kind of bacterial infection. Then we had a video, just to tell them, because a lot of people were panicking, whether should I get admitted, my oxygen is dropping. So we had this video, wherein they can do the breathing exercise, hold it for some time and breathe out. And if they were able to breathe in for, say about 10 seconds, that means your lungs vital is still fine. They did not panic. And then the blood test, which in India we have a liberty to, recommend and do test. So we used to also monitor them and advise, what's happening day to day wise. And then this is a chart what we used to make for each patients as to what is the counts going up and down, so that it was very easy for us to understand whether he is deteriorating or improving. And CT scan, I might not go much further into this, but you all know, fibrosis, post COVID fibrosis, they were really challenging cases. And simple measures like having steam inhalation, putting eucalyptus drop in that, ajwain, a breathing exercise, gargling with iodine solution, or simple salt water solution, or having a simple traditional home remedies also were very helpful. So I think if we advocate and make this, reach out to every patients, then it would be much easy for them also to at least, start something before they visit you, and not just unnecessarily pop in any medicine and suppress that thing. But the idea is to stimulate your own immune system so that they can recover fast. So this is a particular interesting case, which we had that time. I think this was with heavy COVID infection with liver cirrhosis. So this patient, my team, my resident doctor, Dr. Kiran, and I were on the phone, and this particular patient was uh, officer in Navy, and he was down with severe COVID infection, and he was in ICCU with 10 liters of oxygen. Now the patients of his family were able to be, getting better with our treatment. So that's why they approached that, so and so patient, if you can do something. So now in such cases, how we should approach is, first of all, see the reports, see where is the situation. Do we have any scope? If yes, then, the best part would be to just observe the patient to see if the hospital allows, if the hospital doesn't allow. Usually we saw in the first phase, they didn't allow us. There were a lot of resistance. But once when they started seeing the results, some doctors were very open-minded and, they allowed us to get into the hospital and start treating. So in this case, what happened was, we started with taking his history, and he said, this is a patient with a known case of liver cirrhosis. So with the fear that, he would get into trouble, they admitted him in the hospital. And what happened was the at that time, his oxygen was getting down. It was about 80, 85 to 90. And that's when they admitted him. The patient approached us when it was day 4, when the oxygen was already down. There was fever 102-degree constant. In spite of taking all possible paracetamols and Meftal, the oxygen was getting down. The case was rapidly deteriorating. So the first thing was the fast progress of deterioration and liver pathology, along with that, COVID pneumonia. So first thing, what was going in my mind was the symptoms was the platelets were dropping. The platelets went up to 46,000, which should be normal 1,50,000 to 4.5 lakhs, which dropped down to 46,000. There was a lot of weakness, obviously, getting unconscious in between, used to speak, used to get unconscious. There was a lot of heavy breathing. He couldn't even speak, sometimes. And there was this heaviness in chest, fever with weakness. And the characteristic symptom which we got was that, sleeping on the right side was difficult for him. But then when we saw that, blood pathology, everything was going down, the WBC was down, platelets were down, that obviously pancytopenia along with the symptoms. We started as a first remedy as a phosphorus. We have a remedy called as phosphorus in dilute aqua form. We started with this. Now, in such patient, we need to observe and be with them, every 3 hours. As to, we used to have monitored him every 3 hours. Is there any progress happening or is going down? Because based on that, we need to again reevaluate and give medicines. And we saw there was no change in next 3 to 8 hours. And, the situation was still same. He was not able to do anything. And the doctors were also, like kind of raised their hands as to we don't know what would be the prognosis of this patient as he's in deep trouble. So now I again started to review the case. We had a video session with the patient, and that was the first time I saw him. He was with all different machines and intubated and oxygen, 10 liters of oxygen was going on. He was barely able to speak, in bits and pieces. So then I understood, we need a remedy which covers the liver pathology along with the lung pathology instead of getting into the, decomposition of blood cells because it was because of the liver pathology. So in rubrics, we have a repertory wherein I took this rubric: chest inflammation, lungs pneumonia, liver complaints in. And the main remedies were, Merck, sanguinaria, iodium, chelidum, and Timtat. And we had this characteristic symptom, with the patient had was cannot lie on the right side. So bang on, I started with my prescription as Merxol 200 every 2 hourly. And the first positive sign was the fever stopped. Although the fever was masked, by Meftal and Dolo injection, which they used to give. But what was happening was, in spite of giving that, the fever used to rise. But after giving this 2 hourly, in next, say about 8 to 10 doses when it happened, this was the first sign. The fever stopped. The second was the platelets started rising from 46,000, it came to 56 and then 76. So this was one more positive sign which made us to hold on with the medicine. But then the doctors over there were of the situation that since the X-ray showed severely gross infected, they said nursing home won't be better for him and he might require more oxygen, so better to shift in the next hospital. But then the patient was a little adamant and saying that I'm finding a little benefit, so I think let's wait and watch. They still gave remdesivir 2 injection, but as the fate would be, the SGPT and SGOT, the liver profile, it flared up. The liver enzyme flared up. Now that was the time when we thought that it's better to again review the patient and see what can be done. So, but now the situation was very crux. Imagine, what was happening at the clinic where there was a lot of patients, regular patients, COVID patients, and such serious emergency cases. And also, not only him, there were other family members also in his house who were affected with COVID. I'll share you about their case also. And what happened was when we reviewed this, on day 3 of treatment, we saw that there's a lot of dyspnea, congestion. He would barely be able to speak. A lot of despair as to what will happen, and there was a lot of heaviness, lying flat on the examining bed. Now, with such complaint, when multi organs are affected, there was a lot of puffiness, edema, not able to breathe, not able to speak. So I started with the remedy digitalis. So after Merxol was done, I started with the remedy digitalis in 30C, and along with that, I alternated with anti-mass. So 1 dose of digitalis and the second round anti-mass. Fortunately, this was the time where the doctors also allowed us, because they said remdesivir injection cannot be given. He's too toxic. He's going down. There was no other chance, and hospital beds were also full in almost all hospitals. So by this alternation, we saw the good thing was in next 24 hours, the platelets definitely increased, the liver enzymes were high, but the oxygen level, which was or 8 liters dependency, came down to 4 liters. So with even 4 liters of oxygen, he would be able to breathe. Now this was a sigh of relief that that we could have a little bit more catch over his case. Now the next day, see, in certain cases, you might not just give a remedy and just relax. Okay, he will be fine. Let's see another patient. No, you should be monitoring every 2 hours, every 3 hours. That's the secret in treating pathological acute cases. Next day, there were a different set of symptoms. So it was about feeling breathless, heavy breathing, not comfortable, He's like he was panting. Maybe one of the reason the doctor over there said that because we shifted on 4 liters, but still the oxygen saturation was able to be maintained. So they didn't want it to again shift it to 8 liters, but they said let's keep on 4 liters and see. So this we took it as air hunger, and then there was a lot of pain in the back, abdomen, liver was affected, oxygen was slowly rising, the lips were dark. So with this, I gave a remedy carbo-veg. And when we saw this rubric, earlier when I mentioned Merck's or what we had choose, the another close remedy, with the liver complaints with similar pathology was chalidonium. So Merxol was given when there was a characteristic symptom of, cannot lie on the right side, and we saw the progress, what happened. But now was the time of a different set of remedies, to further progress the case. And then after this medicine, oh, there was a miraculous result. So we used to decide, discuss in our team, was it that we used to give this medicine earlier, or was the last remedy right? No, it's not like that. It's like peeling every layer of onion. There'll be a cluster of symptoms, but you need to catch hold of what is happening right now with the patient. So based on the characteristic symptom and with the sphere of action, you give a remedy, see the action. If it's not progressing, try another remedy, and that's how you build up a case and the treatment protocols. And then gradually you see, this is the chart what we had maintained. The platelets were rising from 45,000 to 56, 73, and then finally it was all normal. So, and also the WBC, the cells, everything rised. And this was the case, where we also proved in the hospital as to, in the sitting in the family of the patient, that how effective homeopathy is even in this hospital setup. And then after, he was discharged, he was all back at home. There was a kind of a sigh of relief, for everyone. And then he had a little bit post COVID, the chest pain and weakness. So for that, we gave 4 doses of Kalikav as a post COVID recovery antisporic, and Elstonia scolaris tincture. Now Elstonia, there were different set of tinctures also which we used during COVID. I will give a chart of that also in my session ahead. And then he visited my clinic, and where he mentioned that it was 75% of lungs were in. And then this was like a ray of hope, and it was such a sigh of relief, working with such patient. So this was one patient where where we had a different approach. And so it's like a drama, that when in clinic it was a chaos, at his hospital he was in this agony, and what was happening in the patient's home was also a different story. This same patient's wife, who was 7 months pregnant, also had COVID. So now imagine that mother's, worry. Husband is in ICU. Doctor said, we don't have hope. Patients, family, everyone were affected. She didn't have any help, and she was down with COVID and 7 months pregnant. Now, our thing is normal. What we need to do is, okay, let's try. So first thing was, I said, just narrate me all the symptoms what you are having. Let me see, how best we can help. And this was the time when the patient was just admitted and we had just begin the treatment. So they were also not sure whether how will this help. And now when I took a record of her symptoms, it was like severe left-sided headache, obviously with weakness and fever. This was there, but the key symptoms was left-sided headache with a lot of nausea and vomiting. It was like banging headache. She couldn't lie, she was restless. At the same time, a little bit of despair and a depressed feeling. There's a lot of this irritability, like a like husband is like this, I am pregnant, who will help me, how will this happen? And obviously any mother would be in such situation. So based on her symptoms, and she told that she was also admitted on 10th, but then with the husband, but then the gynec was not keen of giving her any injections or any allopathic medicines. So she simply gave paracetamol and vitamins and said, you be better at home and then be on call. And then the symptoms were vomiting, sensation at night, cannot eat food, severe headache, especially forehead and left side, with nausea. So based on this, I gave her medicine sepia, because in sepia you have this combination of forehead, heaviness, nausea, vomiting with terrible headache. and obviously with all the other characteristic symptoms and the feel during that sensation. So based with CPR, what we saw was after giving 3 doses per day for 3 days, the fever stopped, the headache also reduced, and there was no allopathic medicines going except for multivitamins. So this was again, the first time when the patient said, okay, my husband is now slowly getting better, where his platelets increased, and at home her headache and fever, everything started getting better. And then obviously after a week's time she was all fine, and she also visited us and just said, our faith in homeopathy has tremendously increased ever since then. So in hospitalized cases or in pregnancy cases of COVID, so homeopathy has helped all of them. And the interesting thing was, like a cherry on cake, in uh, now in this fourth wave, just last month, that same patient who was pregnant, and the little baby who delivered after the treatment, and yeah, I forgot to mention, delivered a healthy baby boy, and absolutely normal, no complications. Now this baby this year got COVID. So the mother, with the pressure of family, obviously she went to a allopathic pediatric who was near to her house, because they stay away from our clinic. And he scribbled or prescribed all this set of medicines, but he was COVID positive, and you've seen the report, and then the medicines were prescribed. Unfortunately, with those medicines, this little baby got this puffiness of face, puffiness of hands, bloated abdomen, and with the rash, you see on the hands, there was this red colored rash all over the body. So he was getting all this kind of side effects of medicines, antivirals and antibiotics, everything together. Now that time, she remembered that last year during our travel, this homeopathy had helped. So then they again approached me, said, that little baby, who was in my tummy, and you had given me medicine. I don't know whether COVID, um, he was exposed to COVID that time or no. But right now, he is down with fever 103 since 3 days. We gave him some medicines, but he has some side effects. So if homeopathy can, help this baby, I said, yes, why not? So we did a video call, and then we saw, the symptoms were throat pain. He was not able to eat food. There was dullness, lethargy, tired, and he's so weak that barely able to see us, and then again sleep. And there was this red rash all over, puffiness, swelling below the eye. So definitely we needed a remedy which had this profound weakness, the throat infection. He didn't have much of cough, so we were sure that he didn't have much of COVID pneumonia, but it's like an upper respiratory tract infection with COVID. High the loose motions, there's a lot of this loose motions, weakness. So we selected a simple medicine, which was arsenic alb, 3 hourly, and along with that, we gave him Paramphos 6C. Now, I don't like to give placebo in such cases. Better to give something which would definitely help him. So I gave this in 6 potency, which was too low, that instead of taking any paracetamol or something, this would be good enough to take. With also an SOS extra medicine of Apis 200, not to be taken right now, but only if you feel the swelling is increasing or if he's gasping, then this would help. And as expected, with homeopathic medicines, what happened? Any guess? So what happened was he started passing lot of urine for that next 12 hours. And in that, all his puffiness and swelling, everything, which was over here, you see, you can't see the arch because it was all puffy. It reduced, and this is flat now. And his fever came down, diarrhea stopped, he was more active, he ate little bit of food, and then he was active. And in the next 3 days, he was all fine. They made a visit to a clinic and said, that thank you once again. Homeopathy helped, rescued the family with this. And you can see, when a little child with the news of, COVID positive with this weakness, side effect, the entire family was under observation, as to what's happening every minute. and then but not let that pressure be on you, but just simply do your work, reevaluate your case, give a medicine, see how it's happening, another medicine. And I think that's the secret of treating acutes. And this was great. And this is a set of different kind of medicines which we had commonly used for different set of COVID patients in this last 2.5 years. I can go on having case of each of these medicines like a series, but this I've just put in a slide so that I can help my homeopathic friends and colleagues. If they come across such patient, we can use this different armamentarium. And this is not only for COVID. Forget the name of disease. As we see in homeopathy, the label of disease is not important. What is important is the sphere of action. The patient, who is he, who is having this illness, is more important. And this can be used in any kind of viral flu with having upper respiratory tract or lower respiratory infection. It can be bacterial infection, it can be COVID, it can be viral pneumonitis, ILDs, post-COVID, many different cases. So, and maybe we don't have much of time, but some other time I would also share
Yeah,
this
yeah.
case, with COVID without fever and how the oxygen level was dropping and how it did. But maybe if I have 5 minutes more, I would like to share this slides, which would be helpful for homeopaths and our colleagues, that different tinctures which
Um,
I used
Actually,
for.
we delight with the time, but okay.
Yes. Maybe they can just have a
If
snapshot of
someone
this.
wants some ones of presentations of the speakers, please write to our email. It's I will write to you now the email.
Yeah, if they want, I would be
Homeopathy
able. I can
voice.
share this. Yeah.
Uh,
Maybe this screenshot you can take. This would be useful.
Screenshot. Okay, but
So I think I would end the presentation here. And there's a lot of cases after cases, which we did. Anyways,
please.
but I would just say that give homeopathy, include homeopathy in your life, and you will see magic happening in your life. So I think thank you very much for the presence hearing. Thank you, Genevieve, for arranging this, calling me once again, and
Thank you,
everyone,
thank
on the
you.
panel. And if you have any queries or something, I would be happy to address them.
Thank you
Thank
very
you.
much, Pankil. I've attended his clinic, but it was in
Yeah.
2015 when I was
Yes.
in the other song for
True. True. True.
to to teach there. Is it the same clinic where you are now?
Yeah. Yes. The same
Yeah.
clinic.
I forgot the address, but if I come, I will try.
Yeah.
I will try to
Most welcome.
to find a way. Okay.
Yes.
Thank you, Pankyo. We will keep in touch. It was very
Okay.
interesting. I was impressed by this research you have done.